Hey guys, so in today's video, I wanted to share my thoughts on a post that I saw asking a question in one of the medical assistant groups that I am a member of on Facebook. And so I thought that I would, like I said, take the time to share my opinions. And I'm sorry, I am a little bit stuffed up, so it may be a little bit of me clearing my voice and things like that in this video. I'm still getting over having a cold. So I'm going to read the question and then I'm going to share my thoughts on this person's question. So here is the question. Out of curiosity, how long does it take you to room a patient? I'm at an urgent care and we have two providers, one for urgent care visits and another for primary care visits. What specialty are you? So I just want to say before I start that I have worked in a bunch of different specialties, and honestly, the amount of time that it takes to room a patient is different for all patients. So it also depends on the type of visit that they're there for, because different visits require different things. And for example, like some primary care visits where they're there for like a physical or a Medicare annual wellness visit, those are going to take more time to room a patient because there's a bunch of questions that you have to ask per Medicare. Um, there's a bunch of screening things that you have to go through. There's also like any care gaps going through and doing med recs, like medication reconciliations, going through all of their med lists, their medical history, surgical history, all of that stuff. That is going to take a little bit longer. So, my average for an urgent care visit is between 5 and 8 minutes. It could be a little bit longer, it could be a little bit shorter, kind of depending on the visit. So if somebody's just there to get like sutures removed or staples removed, those are probably the quickest, other than like a blood pressure check or an immunization visit where they're literally just there to get like a shot, and those can be done in nurse visits. Those don't have to be like actually roomed. The only thing that we had to do per the hospital policy where I worked was take their temperature if they were there for a nurse visit. Most of the time, I would take their temperature, I would count respirations. Depending on the person, I may also check their blood pressure. Some people requested that we check their blood pressure, but for a nurse visit, you only have to do temperature. Um, and then, like, for an actual urgent care visit where they're seeing the provider, like I said, it would take me anywhere from like 5 to 8 minutes, sometimes a little bit longer, depending on if the person is someone who likes to talk, or depending on if it's some weird injury where I feel like they need to answer some questions about how it actually happened. Or if it's like a mental health type of thing where they're coming in because they are feeling suicidal or something like that. Like our providers couldn't really do anything for them as far as the suicidal ideations and stuff like that. We would end up having to send them to the emergency room because at the urgent care where I worked at, even though we were hospital based, um, we did not have the ability to admit someone to the hospital or to transfer them out to a different facility because the hospital that I worked at did not have any sort of behavioral health care like unit or anything like that. We literally just have swing beds where people can go and get physical therapy. Um, and we had like our med surge type of unit. So um, the longest would be a Medicare wellness, and sometimes those could take up to 20 minutes, which is why I used to really hate it when patients would show up like even 5 minutes late for their appointment because you've already lost like 25 minutes of time without even realizing it. So if you're coming in for a 30-minute visit and you've already wasted like 25 minutes of your time because we have to ask you all of these questions for Medicare purposes, and go through all of your health care gaps, close all of the gaps that we can, ask about immunizations, all of these things, like updating your chart, it takes a lot of time. Now, like I said, the quickest ones were nurse visits, but as far as rooming for the provider, I tried to get down like a little script so that when I would go into the room, I would have everything in mind already that I needed to ask. And I had like from beginning to end And I've gone over this in other videos where I've kind of gone through the whole script of what I would say, how I would run like the whole rooming process. And I feel like it was more efficient when I had that all kind of set up ahead of time. So then I had a way that I would consistently do things. And it definitely made things easier on my part. Um, I like the urgent care that I worked at, we did not do primary care visits for urgent care. Like our urgent care providers would not do primary care visits on the days that they were supposed to be running urgent care, unless it was like a day where a primary care provider was covering because there was no urgent care provider. In which case, unless they were able to reschedule the appointments that they already had scheduled for that day, they would still be seeing primary care patients and urgent care patients, which that was usually a cluster. Um, but yeah, for the majority of my patients, the amount of time it took was between 5 to 8 minutes. The longest I've had was 20 minutes, and that was for a Medicare annual wellness visit. And I've also had a longer visit where it was an urgent care visit, but the teenager came in for mental health problems, and it was just a lot of back and forth because the teenager's parent came with her, and they were like going back and forth, and the mother was trying to answer questions, and it was just a very difficult communication process because we needed the teenager to answer the questions and the parent was trying to answer for them, and so it made things a lot more difficult than they needed to be. So anyways, hopefully that answers your question. Like I said, I've worked in a majority of specialties, but my main specialty, the main two specialties that I worked in were family care or family practice and urgent care. I kind of merged the two there. But, anyways, if you guys have any questions or any other topics you would like to hear me talk about on my channel, let me know. I'd be glad to get something filmed for you. And with that being said, I will talk to you guys next time.